Hey guys, welcome back to another episode of the AltMed podcast. My name is Andrew Dowling. With me, as always, Mitch Kurtz, and a guest today who works very close. Sorry, Mitch, how are you going? I meant to ask.
I'm good, mate. I'm good. Thank you for letting me
Yeah,
interject there. Yeah,
that's all right. I just saw your face kind of drop a little bit when I didn't ask how you're going, and I
yeah.
just needed
Well,
to make sure that
Important to
feel
check in
better.
with each other.
it is Shannon. I've just given away the name of our guest. We've got Shannon Arenson from Seutika Pharmacy. Shannon, welcome to the show.
Thank you so much for having me.
Um,
We did it.
we did do it. We've been talking about this for a little while, and it's finally happening. Mate, before we talk a little bit about all the stuff that's of common interest to us, do you want to maybe just give our listeners a bit of background about you and how you found cannabis?
Yeah, sure. I'd say more cannabis found me, but my name is Shannon Arenson. I'm the dispensary manager at Seutika Pharmacy. My relationship with cannabis is almost 2 decades old now. But I'd say this current relationship that I'm in with cannabis is probably closer to 12 years old. Um, I'd say like any standard neurodivergent individual or non-atypical person, I found myself, uh, I guess, introduced to cannabis in your traditional way, but fell in love with it in the non-traditional way. Having to reassess my relationship with cannabis as well 12 years ago gave me so much more of a deeper understanding of what this potentially could be for myself, but also the greater public. And me knowing myself, always moving towards kind of self-development, self-understanding, self-growth, wanting to be kind of, I wouldn't say a healer, but I've always gravitated towards encouraging people to do better, be better for themselves, and I guess striving towards happiness is at the end of the goal. End of the day is the goal. Uh, it's hard not to fall in love with something that has made such a significant impact on your life. And I think going through the healthcare pathways and always wanting to work in health, finding pharmacy as my avenue, it's allowed me to bring in something that I'm very passionate about, something that has helped me in massive ways into my career pathway, into my place of practice. And it's just a very exciting time. It's only scratching the surface in the industry, I would say, if you guys would agree with me. We've got
Totally
so
agree.
much more to go.
There's so much more upside, length to go, or whatever you want to call it. But it sounds like you've had a long-term relationship with cannabis and the passion's still there. So we love to hear that. But talk to me, applying your pharmacist lens, how long have you been dispensing, and what are some of the things you've kind of observed from our industry in that capacity?
So I've been working with medical cannabis, I'd say, since late 2018, early 2019. We got in very early at the various workplaces. I'd actually, before I moved to Melbourne, I was actually on a 2 year adventure across the globe. And when I eventually moved back to Australia, there was a lot of incentive to move to Melbourne. I found myself at various hospital sites and community pharmacies. And very early on, I noticed medical cannabis was already making waves. Even at that very, very beginning, it was just an interest to healthcare professionals. It was an interest to the public. And when I finally made my way to Seutika Pharmacy, I was a cannabis patient already. We were doing about 3 scripts a month, and they were all mine. And I said to my boss, "This is something that we should do." At Seutika, we specialize in I guess a clinical approach to pharmacy. We service a lot of aged care facilities across Melbourne, as well as doing a lot of the ongoing care for the psychiatric patients at the Alfred Hospital.
Right.
And our clinical guidance and approach to medicine, we take a hospital approach to our community patients. And when I saw the opportunity to pull cannabis into the pharmacy, the results and the job satisfaction and the patient feedback and the satisfaction through my staff just continued to develop and grow like the industry is. So it was something that was almost a manifestation of 10 years of obsessing over this product and wanting to work with it. And moving into healthcare, I always wanted to help people, but I didn't necessarily want to touch people. Not that I've got any issue with touching people, but it was just for me, I just wanted to take a step back. I found myself in pharmacy because it's such a beautiful intermediary between all of the other healthcare professionals. You get such a wide scope of knowledge and you have to be able to know when to refer. This tied in perfectly with cannabis being a medicine, being something that's so complex and can affect polypharmacy significantly in theory. When I saw the opportunity to actually bring it into my practice, it was a no-brainer for me, and I hustled to get it into the pharmacy.
We love the hustle, Shannon. And sorry, I've just never actually thought of that dichotomy between healthcare professionals as like there's those who touch and those who are hands off. Doctors touch. I realize that now. I should have understood that earlier.
Where has the doctor touched you, Andrew?
Yeah, I don't want to talk about it. But what I did want to talk about was something that piqued my interest that you just mentioned was that you're providing assistance to some of the Alfred, and for those who don't live inside the Melbourne bubble that Shannon, Mitch, and I do. The Alfred is one of the biggest hospitals in Melbourne and has, as I understand, quite an extensive range of psych inpatient and outpatient programs. I wanted to know, because this is when I have mentioned to people that I work in the medicinal cannabis space, depending on how conservative the person I'm speaking to is, they will be like, oh, it's really bad for people's mental health, or it's going to cause psychosis. It's this, that, and the other. I mean, I know enough to be able to say that, that's the headline, but there's a little bit more nuance behind that. But in your, I guess, clinical practice as a pharmacist, what are your observations about that? And because, in the spirit of a fair and balanced discussion, of course, there is a risk of psychosis with some patients, but can you talk to us about that?
Yeah, for sure. I can definitely talk about my experience and my interactions with other healthcare professionals. I definitely would like to start this off with saying everyone assumes that the biggest barrier to entry for medical cannabis in Australia is probably the driving laws, or the biggest barrier to entry globally would probably be the driving laws. I would say that the biggest barrier to entry in Australia is probably the lack of understanding or the lack of willingness to start understanding medical cannabis in the already experienced medical space. Throughout 2020 and 2019, I was, as I said, hustling to inform consultants and already senior prescribers of this emerging medicine. I was doing what I could to catch up with the Alfred's psych team, with their addiction team, with the ED team, doing basic kind of introductions to the endocannabinoid system. What is CBD? What is THC? How do they work together? What does this mean for future medicine? And it was shocking to me after a few of these workshops that I would do, or little kind of webinars. Even at the end of a webinar, you'd have some of the ED specialists asking, so is there just going to be a line outside the ED department when they legalize CBD? So the unwillingness for some to start their learning, or the unwillingness to even recognize the potential for these products, that was a big hurdle for us at Seutika to get over, especially being an independent pharmacy. We're a one-off site. We work very closely with some of the public sectors, and a lot of the public sectors will not touch medical cannabis for insurance reasons. So why would someone start learning about a product that they can't even implement into their own practice. So that was a massive barrier for entry for us at Seutika, not tying in with any kind of cannabis clinics or pairing with any specific cannabis doctors. And a lot of it was just education, constant repetition of discussing the potential benefits, discussing the need to practice beyond what's available as evidence, and essentially just encouraging other healthcare professionals in our space to just start reading. Even if they weren't going to implement it into their practice, we thought it was so important to start reading about it because eventually patients would start asking about it.
Do you think that ultimately it actually belongs in a pharmacy?
Absolutely. I think more in a pharmacy in the medical space than anywhere else. I think there is a significant difference between a recreational approach and a medicinal approach. I do believe there's a role for both. I don't think we're there yet in Australia. And I think the more we can prove right by the TGA, the sooner we will work towards legalization or even decriminalization. I think it's important to remember that the TGA never wanted the responsibility. They were just given it. I think that a lot of what's happening in terms of the emerging regulations and evolving regulations aren't always done on a common sense basis or on a basis from, let's say, cannabis folk.
And the understatement of the year goes to, yeah, I agree. There's a lack of common sense. I should say it's two-way, in that I think the industry also wanted to have a standalone regulator and not have the TGA. But yeah, we're kind of strange bedfellows stuck together for now, and everyone's trying to make it work.
The blind leading the blind.
Much better description.
I think it's amazing what Canada Health is doing. Health Canada, I think they are trying to stand ahead in terms of its practices and regulations. I do think that the guidance of a healthcare professional can significantly impact a patient's therapeutic outcomes. And I think us being pharmacists, being therapeutic optimizers, that's really the main thing a pharmacist is good at is shifting liability. The second thing would be optimizing treatment pathways, being the experts in the treatment, not necessarily the pathophysiology of the disease. So if you have a patient with a diagnosis and they've either on pharmacological intervention or they're on CBT or they're on some sort of physical therapies, I think the involvement of a community pharmacist, the involvement of an individual that patients can reach out to, rely on, ask for advice or questions, or ask for guidance on referral, I think that's so important for the patients. It creates that bridge as well for the patients and the prescribers, where the patients wouldn't necessarily always have continuous access to the prescribers. Pharmacy is a free service to anyone in the public.
Yep. But it's also like the adverse event profile also of what you're dealing with. I mean, yeah, some heavy duty prescription drugs that I've been given over the years, be it for, treatment of a bacterial infection or whatever, but they range from, could experience hair loss or jaundice or loss of libido and all this stuff. I'm like, I am still yet to, I appreciate there's people who medicinal cannabis doesn't work for. But if something doesn't work, it's better than jaundice. Surely we can draw a line there. But
I think it's always a risk versus benefit. I think it's always really important to outweigh the risks versus the benefit. What we do know about cannabis is we don't know how it's going to respond. We don't know if patients are actually going to benefit from it. But what we do understand is it's safe to try. And if patients have exhausted all other options, if they're getting to the point where they're just lost and they don't know what's next, we know that cannabis, for the most part, is safe to try. And that was a big thing that I was doing like 2019, early 2020, was going to different doctors' clinics that we already worked with, and asking them, have you considered medical cannabis? Oh no, I don't want it. I don't even want to do it. It doesn't work. I was like, well, why do you think it doesn't work? And it's just about asking those questions. I even had a doctor once that I sat down with and we were just chatting, and he goes to me, Shannon, I don't want you to be sending me people with drug seeking behavior. And I said, doctor, I have referral pathways. I'm not looking to send you any patients or referrals. What I want you to do is consider it for your patients who are at the end of the road, who have no other options. We've got a product that has a significantly lower side effect profile to standard pharmacological interventions. We have a product that's far less invasive to the body, and we have a product that has been used for over 5,000 years for medicinal use. It's got 10,000 years of recorded history in humanity. And then obviously like those documented cases from China from 5,000 years ago being used as a medicine. So we've got a product that throughout humanity has been used for millennia. But why not try it?
Yeah, I'm open to that, but the problem is that 5,000 years ago the product wasn't GMP. So I think we need to bear in mind the fact.
Exactly. So we have
probably cleaner,
significantly better standards. It's the same reason as patients going, I don't trust the vaccines because of those issues 20, 30 years ago where someone took a vaccine and their arm fell off or they grew a tail. Like, well, we have practices in place to eliminate bias now. We have practices in place to eliminate misinformation. We have significantly better standards.
Yeah, totally. And
so do you think that we see it? Well, I'm going off topic now here, but
can I say one last thing on that, which is that the current applicable regulatory standard of TGO93 is intended to be a safety and quality standard for medicinal cannabis products supplied in Australia. In order for a product to be registered on our approved medicines list, the Australian Register of Therapeutic Goods, the medicine regulator, the TGA, needs to evaluate that medicine for quality, safety, and efficacy. So on the one hand, you're kind of like, well, TGO93 knocks out two of those. It's just efficacy, really. And if you're not putting those products then that are assumingly, well, compliant with TGO93, they're ergo safe, quality. If you're not putting them through $1 million clinical trials to then demonstrate efficacy, yeah, the product's almost there. It just, then it just relies.
Again, I think that's again where we're trying to emphasize as healthcare professionals in this incredibly niche but rapidly evolving space is to practice beyond what's available as evidence. We're practicing based off what we see in practice. We're practicing based off what we see from our other colleagues or clinicians, or as pharmacists, I'm able to gain feedback and get direct feedback from patients to be able to relay that back to the prescribers. And in the conversation of efficacy, I think that's so important because it's not as simple as having one molecule to lower blood pressure. There's over 700 phytochemicals in a cannabis plant, maybe 60 to 90 of which are cannabinoids. So we really don't know how a particular product is going to respond with a particular patient. Maybe this particular product makes 7 people incredibly sedated, but then 3 people are bouncing off the walls. So in the sense of efficacy, it's not black and white. It can be such a journey to tailor therapies to specific patients. And it's so important to treat every single treatment pathway as a case-by-case situation. Not everything's going to be uniform, or it's not always going to meet the consensus. And if some patients get a phenomenal result off a particular product, it does not necessarily mean you're going to get the same result or negative results for a different patient.
So on the one hand, you're saying that you obviously believe it's a medicine and it's a medicine first. On the other hand, you're saying it's very safe and should be able to be tried pretty,
relatively very
openly.
safe.
Do you think that, could you see a world in which doctors weren't involved in the process and it was all pharmacist interaction?
So like at the moment, I think it is always so important to consult with your prescriber if you are considering any sort of changes to your treatment. I think it's always important to consider a second opinion if your own prescriber or healthcare professionals aren't necessarily informed in this particular field. I think the way pharmacy is moving If you've got a diagnosis, let's take, for example, the emergency or the, let's say, ongoing contraceptive pill. If someone has been on the contraceptive pill for years and they just need a repeat, a refill, and they don't want to see the doctor every 6 months for this particular topic, we're moving to a point where pharmacists can reissue these scripts. Similarly, with cardiovascular medications, we're moving to a point where pharmacists can reissue certain scripts. And if there is a need for a review, then the pharmacist must encourage the patients to go for their doctor's review. It would be amazing in the future to see more weight and more of a responsibility in pharmacies around cannabis supply. I know that we're far from the point of having bud tenders and a point where patients can walk in for a gram of the day kind of situation. And again, I think that's going to be more of a recreational pathway. I think in the medicinal pathway, where there is a need for untaxed, high quality medicine for patients in need, I think it would be amazing to see more power given, not even necessarily power, but more influence given to pharmacists and pharmacies. But this would also require significantly more education tailored to pharmacists and pharmacies.
All right. Well, there's a little bit to unpack there. So does that mean you're kind of advocating for a position where if it goes full legalization, that it would still be dispensed from a pharmacy, because that would be like a safe place to get it, but it just wouldn't be obviously prescription only medicine. It would be like any other product that you can buy over the counter at a pharmacy? Or how do you see that?
I think there's a role for both. I think that it's important to separate the pathways. I think that there is a role for the medicinal pathways. I think there is a role for the recreational pathways. I think, again, the more that we can prove right to the TGA of how we're doing it medically, the sooner we will work towards complete legalization. I think there will be an avenue for people who just want to walk in and get the gram of the day, or just want to get their 28 grams for the month, or whatever it is. Yeah. I think there will be a need for people who are looking for more guidance, who maybe need a regulated, untaxed, high quality product with the support of healthcare professionals around them. The crazy thing to me is the amount of patients I'm seeing who come in who really have no idea, or have such a different idea of how to actually medicate. I see so many people who are new to the cannabis space, who are cannabis naive, coming into our pharmacy, who truly have no idea how to operate a dry herb vaporizer or a TGA approved medical device. I see patients who are coming in who are overdosing, let's say, not well, overdoing it with their oils because they haven't titrated properly. I think the involvement of a clinical team in any situation can just drastically improve treatment outcomes. And
absolutely,
we see this a lot at our pharmacy. I truly believe our pharmacy stands above in clinical guidance around medical cannabis in Australia. And the amount of patients who I see coming from other clinics or other pharmacies who just need a little bit more support, a little bit more feedback, a little bit more guidance, or even just a team that they can bounce ideas with. I myself, as a patient, I've been very involved in all things cannabis since the start of the industry. I've managed to meet incredible people in the industry, such as yourselves. And I think there is a significant lack of, I guess it's a form of access. There's a lack of access to true quality information for patients. There's plenty of access now for healthcare professionals and industry leaders, but when it's coming to the patients, I don't think that information is being relayed well. I don't think people, like in a pharmacy sense, where you would normally teach someone how to use a metered dose inhaler, or you teach them how to apply a patch properly. There's nothing like that for cannabis. So
isn't it arguably because it's such a different medicine to traditional medicine?
Exactly.
Like,
it's such a different medicine, and there has been no emphasis on the education of this medicine through the greater healthcare professional
but I mean,
population.
you've got this interesting perspective, right, where you've got doctors learning about THC and CBD, for example, but they're not really learning about terpenes. Some of them are, but they're self-educating because the TGA doesn't consider them active. So if you've kind of got this weird scenario where you've got things that modulate, I should say potentially modulate the experience, but I mean, based on feedback, it's quite clear that there is differences between call it different strains, let's say. Do you think there should be some kind of other education that doctors need to undertake in order to prescribe cannabis effectively?
I definitely think language around cannabis is a big, again, barrier for patients. I think that the way the industry is currently, I think there's amazing practitioners in the field. And with all due respect, I think there's a lot of amazing practitioners in the field who are experts in their own field of practice, are moving towards a cannabis space, and then they hold an expert title on medical cannabis purely legally only. They don't necessarily have a true expertise on the endocannabinoid system or even cultivars. I think it's tough for doctors as well when they've been considered experts in their field and now they're moving into a field of medicine where there's really not much evidence. There's really not much to go off. All we know about really is THC. We're getting some emerging studies on CBD. We're starting to learn more about the acidic compounds and minor cannabinoids. And obviously through the cannabis space, we're focusing so much more on terpenes and terpene profiles and the really differentiating factors between different cultivars. At the moment, I want to see prescribers learning more about the patient's experience, how they all actually respond to specific cultivars. And yeah, you're right. Getting doctors to understand why do different cultivars do different things? How can 20% THC flowers do different things?
But this is, by the way, why we need gram of the day. Like, I know some of the listeners will laugh and think, oh, that's recce chat kind of thing. Well, it's not actually. For a patient, it would give them an opportunity to sample the field, find a cultivar that has the desired effects. Sometimes I've heard people say, oh, it's really worked wonders for helping me sleep. The only problem was it made me, quite hungry. And then other ones, you don't feel that hunger aspect.
I was going to say that sounds very like non-clinical in the sense that it's very like trial and error. But then I think about it, and I'm like, actually, some patients, have to trial and error their way through antibiotics.
Exactly.
Or have to trial and error their way through pain.
Maybe mental health stuff and psychiatric stuff. I think with antibiotics is a more definitive guidelines. But I 100% agree.
Yeah.
I think cannabis can be a phenomenal tool. I think patients can adopt that tool to help them, benefit in their lives, whether they have one cannabis product or 10 cannabis products to suit different moods or whatever they want to do. I think so. I work with some doctors who write 1 gram or 2.5 gram scripts. We were one of the only pharmacies. I think some pharmacies are doing it now. For the longest time, we were one of the only pharmacies that offered 2.5 gram containers or 1 gram containers for the purpose of helping patients find their flowers, ones that suit them, that benefit them.
Can you take us through that? There's been a few people that have kind of, let's say, queried that approach. I'd love to get some more info on that. Just to
I had
set
some
the record
very unusual queries. I even had one prescriber ask me, is it legal to do broken packs? Won't the flower degrade like an oral dissolving wafer like Suboxone? And I had to be like, cannabis is not lipophilic, it's hydrophilic. If that was the case, if it was going to dissolve like an oral dissolving wafer, we would only be selling 0.5 gram a day anyway.
But Shannon, it can only be sold in 10 grams at a time. Like, you cannot possibly modify that quantity.
No, but hold on. The argument is, for example, if you
I think that's how the argument goes, isn't it?
Yeah, exactly. It's like how could I if I get a script for oxycodone 20 and the patient's eating 20 tablets a day, but the script is for 4, I'm going to give 4.
And also,
yes,
but as much as you split it out, you can also consolidate it. Like, someone was telling me they came to your pharmacy for a kilogram of the day setup recently, but no, I actually think that
jokes aside, though, no, wait. I think the argument, though, on the other side is that you've got stability data, right, that says that this product is good for X, Y, Z. It might be nitrogen flushed, it might be heat sealed, all the rest. When you split a pack of oxycodone, they're still contained within the packaging that they come in. The cannabis might not be.
So it's not an oral dissolving wafer. And I would argue that if you're going to argue based off the 10-gram final product, how are some
I'm playing
pharmacies...
devil's advocate, by the way.
No, I get that. I completely get that. I know that you're just asking, but how are compounding pharmacies buying a kilogram of flour at a time? What's the regulations and requirements around testing of those compounded APIs, where I don't know if they're wearing gloves as they're shoveling through the nugs. I don't know how they're going to be storing. So every time I've had companies say, well, why don't you just buy a kilo of flour and sell 2.5 grams like that? For me, there's much less risk in opening up a 10-gram tub, which is what we can do in accordance with pharmacy guidelines and rules. We can make broken packs as long as it's stored appropriately and as long as it's packaged in according with Schedule 8 medication, being a child-proof container. I remember, I think compounding pharmacies, initially, they weren't even using child-proof containers. And I was shocked at the lack of methodical thought behind compounded cannabis.
They're allowed to, sorry, just to clarify, and this is a legal perspective, compounding pharmacies are allowed to do whatever they want.
Which is ridiculous. So when I wanted to, for the sake of a patient, rather than selling 10 grams of flour for something that they might not respond to, I worked with a number of prescribers who would write 1 or 2.5 gram containers for the purpose of helping patients find their specific cultivars that help them and allow them to do what they need to do for the purpose of, treatment goals. So I'm so for patients trying different products if their prescribers allow it for the sake of optimizing their therapy. What can be a problem for the industry, and I think for the industry's growth, is when patients have stabilized on a particular product, and if it's still working well for them, it hasn't stopped working, they haven't built up a tolerance to the effects, but patients who will be like, yeah, here's 7 flowers I love, they all work for me, but what else have you got? What's new? This can cause such issues internally. It's time that affects, the pharmacy. It's time that it involves the doctor in terms of getting that approval to make changes. So we work with a number of doctors who trust us in our cultivar kind of selection for specific patients. They trust us in choosing 1 or 2.5 gram containers for their patients. We feed that information back to the prescribers so we can work towards treatment goals. And medicine's always about stability, unfortunately, rather than continuously improving. I don't think it's inappropriate to continuously reassess treatment goals. And I'll often ask patients if they've been stable on a flower for a few months, I go, how are you going? How are you tolerating it? How's your symptoms? And if there's a need to review with the doctors, that's something that can be brought up in the consult. I think that in terms of risk, being able to open up an already finished 10-gram tub rather than buying a kilogram of flour and doing it that compounded way, for us is much safer for the patients. It's much safer for ourselves as well, the risk and the risk of contamination. It just, for me, made so much sense to be able to offer those sample or broken containers for patients. And patients loved it. Doctors loved it. It's safer. It's more cost effective.
It's
interesting.
Yeah, it is. I actually totally understand where you're coming from, Shannon, actually. Like, the only query I had is, so if I'm not mistaken, compounding pharmacists, they have a 6-month shelf life, I think, on what they compound. Is that the same for when you split out?
So we don't have a guideline based off it, because when we approached the TGA about and we asked the pharmacy board what would be appropriate, they never really gave us any definitive guidelines. Yeah. So we came up with the idea that once a tub's been open for 3 months, we just discard it.
Yeah, I don't think it is 6 months, Sandra. I think it's 1 month, but I think it depends on the pharmacy. It can justify different things based on their own understanding.
Okay. All right.
So at the end of the day, as long as the product's being sealed, our 2.5 gram and 1 gram containers, they air seal, so they're airtight, nothing leaks out. What we'll usually do is if we open up a 10 gram, we might weigh out all 4 2.5 gram containers from the beginning, so we're not just opening and closing the tubs continuously. We were helped with MedReleaf by MedReleaf develop these 2.5 gram containers as well, because there was that need for shorter quantities. And I think in 2020 MedReleaf were pushing for some sort of broken pack initiative. I put my hand up. I had my board inspections. I had the TGA query us about it. They didn't raise any issues. We document so heavily what's being weighed out, what's being thrown out, what's being prescribed or dispensed, and we keep everything in hard and digital version. So everything that we do in terms of the broken packs is in accordance, in line with what we can do as pharmacists. And when I did have some pushback from prescribers asking if what we were doing was legal or illegal, it was a bit of a shock, because I couldn't imagine pharmacies practicing in an illegal manner. I mean, I know it happens. Melbourne's notorious for terrible pharmacy practices over the last 30, 40 years.
This is an invitation right there to no, we don't have to name names or do drive-bys, but I know we've got only a little bit more time up our sleeve, but I just wanted to just kind of quickly ask, as you're getting more competition into your space, more pharmacies that are offering medicinal cannabis dispensing services, are you feeling a little bit of the competition now more than ever, or?
Well, so I thought we were always the competition. In my mind, Seutika was the competition. We built our patient base completely by word of mouth. We built our patient base by me going out to prescribers and educating them as if an MSL would, but I went with the basis of not representing a particular company, not representing a particular product, and just being there for patients. So through educating prescribers, through educating patients, we've been able to build a phenomenal referral network and a phenomenal doctor relationship basis nationwide. We work with doctors in New South Wales, we work with doctors in Western Australia, we work with doctors in Queensland, and we have patients seeking us out nationwide as well, just looking for more support and more guidance, whether they come to us just to bounce some ideas and they go back to their local pharmacy, or whether they choose to stay with Seutika. My goal at Seutika is to lift up the whole industry. There's enough of a pie that everyone can benefit, that everyone can find success. We're not looking to take away customers from other pharmacies, and we're not looking to compete with other pharmacies. I think we should all be looking after each other. In the sense of, have we felt the competition? Yes, I have, because I get more and more patients from other clinics coming to our pharmacy looking for more support. So I've always seen Seutika as the competition for the industry, because we're trying to stand above in our clinical guidance. We're trying to stand above in our conversation and the way we articulate around cannabis. And we're trying to stay above in the community aspect. We want this to be a place where patients feel comfortable to come and chat and talk about it and share their experiences, and build a culture and understanding of education needed for cannabis.
I love that, and we love your pharmacy. Yeah, it's a great pharmacy. Just right,
it's old school. It's very old school.
Yeah, but it's like immediately as soon as you walk in, you get service and someone who's actually got the time to chat with you for a little while about your
Correct you. We don't have the time. We make the time.
Make the time.
All of us are on borrowed time. We just make the time.
That's why you work so late, right? No, very good. Mitch, I'm just watching the clock. I know we've got to wrap up. Any other questions from you?
I'd love to finish on actually how I met you guys, because it's a story that I really appreciate, and I always go back to it. And I really am so proud with the relationships that Seutika has with ethical manufacturers such as Phytoka. I actually met Andrew at one of the first Catalyst Honolulu meetups, And we just started speaking about a specific cultivar that Mitch's uncle was actually responsible in creating. And Andrew just goes to me, "Oh, that's Mitch's uncle." And I was like, "Who are you guys?" And Andrew goes, "Phytoka." And I just thought, oh my God, your FS70 is one of the best oils on the market.
So
And that's kind of how our
we don't talk
relationship
about
started.
products on that. So we'll probably have to
I'm
stop.
sorry, but it was just interesting because I was really proud to find a product that I thought was producing phenomenal results, and just to meet in that way was just like a really kind of special moment.
Maybe this could be our first. It could be our first. Maybe we'll bleep it, Andrew. We'll bleep it out.
Yeah, just say the product.
Yeah, no, totally. No, I remember that night. I have a feeling it may have been an event that Ndoka was behind, but yes, we were in the city at
Probably.
Yeah, you're right.
and yeah, no, it was great. I just immediately was struck by the depth of your knowledge around cultivars, and I thought I need to put you in the same room as Mitch. And whilst I have achieved that, I haven't achieved that today because we're all in different rooms undertaking this Zoom call. But yes, I just knew you'd get along famously. And at some point you'll have to meet Uncle Scott. But
absolutely.
the legend of Shanti Baba. No, thank you, Shannon. I really appreciate your time and insights from behind the pharmacy counter. It's as you know, we're a big fan of you and the pharmacy. So thank you so much for.
And I love you guys, and thanks so much for having me. And I'm so glad we could finally get this done.
Yeah,
it'll be love the AltMed podcast.
I feel like we could do this again and chat for 3 hours. Whether our audience wants to hear that, I don't know, but I feel like we could do that.
The data says they do. The data says they do.
Yeah, absolutely.
All right. Thanks so much.
Probably a whole segment on dry herb and TJ approved vapes and my thoughts on them.
Oh yes,
yeah, we could do it.
We do need to.
I know that there's definitely a little place in my heart in the Phytoka team, and you guys have a heart, Seutika, and then outside, it's just always really a pleasure to interact with you guys, and your team is phenomenal and so good for the industry. So I appreciate everything that you do.
No, likewise.
Thanks, mate. We appreciate it.
Thanks so much, Shannon. Until next time, we'll take care.
Peace,
thanks,
guys.
Ledge. Have a good one.
Talk soon.
Bye.